yourself.
Hi, thank you so much for tuning in to our second Facebook Live video for National Suicide Prevention Month. Today, we're going to be discussing suicide prevention among the military community, and we're joined by some of our great experts here. We're going to pause for just a few minutes to let other folks log on to the video, but in the meantime, I'll just go ahead and warn those watching from home that a lot of us are working from home today, so you might hear kids or dogs or something like that in the background, so just bear with us. And we hope you find the video today really helpful and informative. So we'll wait just a few seconds and then we'll get started. All right, so we're going to go ahead and get started again. My name is Robert Lambert. I'm the PR manager with Centerstone, and we're joined here by three great people who are going to be talking to us today about suicide prevention among the military community. And with that, I'll turn it over to Dr. Jodie Robison to introduce herself, and then we'll let our other speakers introduce themselves as well. Jodie?
Hey everybody, my name is Dr. Jodie Robison. I'm the Executive Director for Centerstone Military Services. I am the child of an Air Force veteran, the spouse of a retired Army veteran, and the parent of an active duty Air Force Staff Sergeant. And by trade, I am a licensed professional counselor.
All right, we'll go ahead and let Justin introduce himself.
All right, so my name is Justin Johnson. I'm the Regional Director for Tennessee Suicide Prevention Network for Memphis, Shelby County. I also served in the United States Marines from 2002 to 2006, and then from 2008 to 2009 with 2 deployments to Iraq. I'm just happy to be here.
Yeah, thank you so much. We're glad you're here. And then I'll last but not least, let Don introduce himself.
Yeah, hi, I'm Don McCasland, and I am a licensed clinical social worker by trade. I work at the Stephen A. Cohen Military Family Clinic at Centerstone here in Clarksville, Tennessee. I was in the Army for a little over 21 years, retired, and 3 tours on Iraq, and old and dusty enough to have been in Desert Storm as a young soldier. And I'm glad to be here.
Thanks, Don.
All right, yeah, we're really glad all three of you here are with us today. So with that, I'm going to launch the first question over to Jodie. Jodie, suicide is a really serious problem amongst the armed forces, veterans, the military community. Can you tell us a little bit about the numbers of service members and veterans who die by suicide?
Absolutely. The number of service members and veterans who die by suicide hovers around 20 per day, and that number includes both veterans and people currently serving in the military. And for those of you who are not familiar with the suicide rates, that rate is 1.5 times higher than for individuals who did not serve in the military. So it is a significant issue.
What factors are known to be associated with these suicidal ideations amongst the veteran and military community?
There are several factors associated with the desire to die by suicide and or suicide attempts. And some of those include depression, heavy binge drinking, what they call administrative discharge from the military, which is a discharge status that could be related to factors such as poor job performance or weight control problems. And also, as an aside, veterans who are within 3 years of transitioning out of the military are particularly vulnerable during that transition period under 3 years of having thoughts of dying by suicide. So those are just some of the factors associated with it.
Excellent, thank you. This next question is for Justin. Justin, you work with the Tennessee Suicide Prevention Network and are involved with the Governor's Challenge to Prevent Suicide in Service Members. Can you talk a little bit about some of the existing prevention efforts, strategies that you are using as part of that work?
Yeah, so much like the Governor's Challenge, TSBN, we work together throughout the state to try to bring different community partners together, because we realize that suicide isn't just one select demographic. Far as like service members, veterans, and their families, that we have to find a way to overlap and get all these different communities involved. So that's a big push, is the Governor's Challenge, and also TSBN. Instead of duplicating services, we try to figure out, hey, what are you doing better that I'm not at? Or should we do something like that? So that way we can maximize and use our best resources. So that is with the Governor's Challenge. We have literally brought together all the, I guess, I don't know how to use this right, the people that are basically on the front lines of advocating and changing the care for our veterans, but also putting best policies and practice in place that we can try to engage all those families and try to ultimately reduce the suicides amongst our veterans as service members and their family.
Excellent, thank you so much. And one common theme or area of discussion that comes up a lot during these discussions is lethal means. And so Jodie has prepared some information for us to kind of walk us through why that's an important thing to consider when talking about suicide prevention among the military.
Absolutely, absolutely. So appreciate the question. Today, I really did want to hone in on lethal means safety as a method for suicide prevention in the veteran and military service member community. And specifically, I wanted to hone in on firearm safety as a tool for suicide prevention in this community. Some of you may be asking why I wanted to hone in on that. In 2017, 70% of male veterans who died by suicide did so through the use of a firearm, and 43% of female veterans who died by suicide in 2017 did so through the use of a firearm. In addition to those statistics, firearms are often a part of a veteran's culture. Veterans, you know, when they become service members, it is part of their military training to be introduced to firearms, to include storage and safe use of the firearm, so it becomes part of their culture. They are also sworn to uphold the Constitution, to include the Second Amendment, which discusses an individual's rights to own firearms, and so they take that very seriously. And lastly, although there are some other factors, one element I wanted to mention is that veterans are often concerned with the possibility of having their ability to own a firearm restricted if they come forward to express some mental health concerns. And these mental health concerns may be contributing to the desire to die by suicide. So if somebody has mental health concerns, they may not discuss their firearm or their plan to die by suicide because they're concerned that their firearms will be taken away. And so that's really why I wanted to hone in on the firearm safety piece of it. But for those of you who don't know, lethal means safety, or lethal means are objects such as firearms and medications that can be used to engage in suicidal, self-directed behavior. They're highly lethal. And lethal means safety is the process of ensuring that that these highly lethal means, of dying by suicide are really out of reach of the individual who wants to die by suicide. During the times of extreme stress, when you see individuals' desire to die by suicide really does increase. And given those unique nuances of the military culture that I just mentioned previously, it really does necessitate some nuances or some specific considerations when you're trying to discuss lethal means safety with military veterans. And for this reason, I really engaged two of my colleagues in this discussion today. Justin Johnson and I partnered together in the Tennessee Governor's Challenge. to prevent suicide in the service member, veteran, and family population. And Don McCasland and I are colleagues here at Centerstone, and they are both combat veterans. And I'm so glad that you agreed to be with me here today in this discussion, gentlemen. I really appreciate your perspectives, and I will end there and allow you to answer questions that Robert puts forth.
Excellent. No, thank you for that background. I think that's really important to have, especially for those watching. So I'll pose this question. I'll just go ahead and pose it to Dawn first, and then after Dawn goes, Justin, you can add in any information you want to add. But how might a veteran approach another fellow veteran about lethal means safety?
Well, I think that the most important thing for people to realize and to share with fellow veterans is that it's not that anybody wants to take away your firearms per se. I mean, it's not like to lose your privilege and not get it back. And the biggest focus, the most important thing is someone's safety in the moment and your safety in the moment. And that's what this is about. That's the focus and the drive. It's not permanent and total loss of your privilege to have a firearm to go hunting or for home protection or whatever. It's just in that moment when someone is struggling. And like Jodie had mentioned, far and above any other means, firearms is the primary means of choice. So we're just trying to ensure, and your buddies are trying to ensure your safety in that moment. It's not like, we're not out to take it permanently, and no one is. It's just we want to make sure you're okay, because that's what we do. We look out for each other. So that's what we're trying to do with that.
Yeah. So I think from a veteran standpoint, I think we know how to be culturally competent and sensitive about approaching each other about mental health issues or even weapon safety. I mean, it's kind of drilled into us from the very beginning, like this is how you handle a firearm. But if I had to speak on one specific issue, it would be to the public on understanding how a weapon is introduced to the veteran from their time and introduction to the military. So from the first time they go to boot camp, they get a weapon. They're responsible for it. There's repercussions if you lose your weapon. From the time they get ready to go on their deployment, I know for me from 29 Palms, the time I checked out my M4 and I went to 29 Palms till the time I got on the bus and flew to Kuwait, that weapon stayed with me the whole time. That was like that was a piece of me. Like that weapon kept me alive for 7-8 months. And to now we approach a veteran that maybe already he or she may not be in the right mindset to explain to them is this isn't a form of punishment. This is for you, because we all get to a point in our lives when we're not okay. But we know through statistics that we just spoke to is if that weapon is present there, there's an impulsivity that could lead to far as lethal means of suicide. So this is the way I teach it in my QPRs, and the way that I approach other veterans is to say that we're not taking your weapon away. This is more about weapon safety, as Don alluded to, is that let me hold on to your weapon. Let your mom, let your family member, let somebody else until you get to a place that you feel you're okay, but nobody is taking your weapons away, because that's a part of freedom. That's a part of them. They've been in life and death situations where that's been the only thing that probably got them home, and that we need to respect that. And that's a big thing to give up. But ultimately, if we approach it from the right angle, could be the difference maker, and it could save their life until they got appropriate mental health resources.
Absolutely. So we have a couple of questions coming in. The first question is, and it sounds like you said it's important to kind of make sure people know, like, we're not taking this weapon away permanently. We're just trying to make sure you're safe, right now in this moment. Are there specific things that people should say or should not say when they're having a conversation like this with one of their fellow veterans?
Yeah.
I think maybe, I'm sorry, go ahead, Justin.
No, just like what Don, this is about safety. This isn't about restriction. This is all about the safety of an individual in the moment. Because a lot of suicides are impulsive acts and any kind of stalling mechanisms. That's why, like, when I work through Veterans Affairs, is a lot of veterans don't use the gun locks. But I had to explain it is that gun lock might stop you for the second that you might reconsider whatever is going on. The same thing as that firearm not being present. Maybe there's a delay. And then maybe they think like, okay, maybe I can call my buddy. I can reach out to such and such and get help.
Yeah. And to add to what Justin was saying, it's an impulsivity thing. And again, research shows that it's, people do plan, people make plans, but in that moment, it's like, I'm going to do it. And it's very impulsive in the moment. So if we can just break that cycle of thinking, break that moment where somebody can step back, and that's going to buy 2 seconds of time, which is oftentimes is enough for somebody to reconsider and think, all right, hang on a second, what's really going on with me right now? What can I do? Do I really want to do this? And I know the conversation is about firearms, but people worry about firearms and being taken away. Other sources of means are also restricted. Things like medications, people ask spouses or family members to hang on to their meds and only give them what they're supposed to have at their dosage times, things of that nature. So it's not just firearms. I want people to know that too. It's not just firearms, and then everything else is, well, don't worry about it. It's all means. So it's not just this hyper focus of firearms. So, yeah.
If I could tap into something that Don just said, because, Justin and Don and I, we work in this field, and we've read research about, for example, suicide prevention methods. But the general public may not be aware that there's research out there that says it could be as little as 5 minutes that somebody has a thought of dying by suicide to when they act. 5 minutes. So it's like, as John and Justin both said, it's an impulsive act many times. And so if we can take care of those 5 minutes, we can save lives. Lethal means safety.
Absolutely. Thank you so much. So we talked a lot about, this lethal means safety from one military service member or veteran to another. Are there things that would need to be tweaked if that conversation were happening between a non-service member and a veteran?
I think maybe people could also tap into not necessarily focusing on, hanging on to the weapon, taking it from them. It could be something as simple as, like's been mentioned a couple of times, a gun lock, taking the bolt out of the weapon, using a gun safe. I mean, it can be things like that. It wouldn't necessarily equate to a total loss, so to say. It can be just a little distance. It's not a loss, it's a distance. Instead of having it here with me, I'm going to have a reason to pause, like a gun lock, or it's in a safe or something like that. So maybe just tapping into that knowledge that it's not a total loss, it's just a pause. So
All right, we have another question that came in. It says, if my weapon gets taken, or if I call a crisis line, does that get reported to my CO?
Not that I know of. Everything is confidential that you talk with anybody about.
Yep, correct. Yeah.
And I think if I could add to tap into what Don was saying, if we can help people focus on safety of family members as well, children in the house possibly, who we think, and we have taught our children not to touch those weapons, but children are children, and sometimes they don't listen to what we advise them not to do, and so they may act on that. So if we can focus on care of children and safety of children and others around, that is also very helpful.
Yeah, I think it's really important that we bring the whole service members of veterans and their families to the conversation because usually they're the first people, the family, to notice a change that if a veteran is suicidal. So as important it is for lethal means safety is um, we should learn the different indicators and warning signs so we know when to intervene and so that we don't over intervene too on that. So we're respecting the individual.
Excellent. So you just mentioned some of these warning signs. Can you talk a little bit about what some warning signs are that someone should look out for?
Yeah, so this is a common one. Sadly, I've lost all 5 friends that I've served with to suicide. And one of the common behaviors that they exhibit um, was anger or aggression. And we didn't understand then, like I do now as a mental health professional, but that was them reaching out. They become difficult to deal with, whether it was substance abuse, either domestic issues. Like we should pay attention to those because maybe not necessarily like they are being a problem, but that's the signs of saying, hey, look, there's something bigger going on here as far as mental health. Maybe we should try to get them appropriate help.
Yeah, and asking somebody is not going to, convince them to follow through with it. If you just straight ask an honest, straightforward question, are you thinking about killing yourself? That's not going to make somebody do it. And that's a myth that's still floating around out there. But, oftentimes, I had mentioned it's just a pause. That can help somebody pause and really consider what's going on and just take a breath and think, whoa, man, I'm thinking that. This is scary. I want to do something about it. That can be a catalyst to somebody seeking out help. And, years and years ago, when I had struggles with PTSD, I had those thoughts of suicide, and they just come to you. And like, for me, it was, if I killed myself, all of this would just stop. And it didn't faze me. I just thought, okay, yep, it's an option. Check the block, so to speak, as we said in the Army, check the block. It's an option. And I just hung on to that. And eventually, somebody asked me, but if I didn't have anybody to ask, I don't know. I just don't know. So you just have to ask the question.
Yeah, thank you for that. In our last video, we talked quite a bit about building community and having those frequent touch points with people, and just checking in on people is so helpful, especially with these suicide prevention efforts. So I'm glad you were able to share that.
And there's no shame if you don't feel comfortable asking the question to find somebody else that can ask.
Absolutely. And I would tap into what both John and Justin said, as far as a risk factor, this job loss as well, or additional stresses. And I think that's in particular why the transition out of the military is a risk factor itself, because whether someone's been in for 4 years or 15 years, that was a way of life. It's particularly if you're active duty, it wasn't just 8 to 4 or 9 to 5, it was 24/7. And, sometimes your home is on base sometimes, and your work is on base, and your friends, and you had a direction you were going in. And when you transition out, those factors change. Sometimes people can get lost in that transition. And that is why it is such a risk factor.
In fact, I'll add to what Jodie's talking about. That first year that you get out of the military is your highest risk year because there's so much transition happens. In fact, that's why the whole Clay Hunt program, sadly, a veteran that we lost to suicide, was to address that to veterans that are just processing out of the military. Because you think about it, the most important thing is that time you're in the military, whether you enjoyed it or not, whether you're 20 years or 4 years, you had a group of friends that you could walk next door to and talk to. You had a support network that was always there. So you go from this giant support network, whether it's the Army, Marines, Navy, Coast Guard, Air Force, to a whole new world, and to a lot of times to homes that you haven't lived in the last 4 or 5 years. So it's all brand new and it's extreme transition. And a lot of things like, or like job wise, it doesn't necessarily transition to the civilian world as fast as veterans would like, because a lot of things take time.
Absolutely. Thank you so much. So we've been talking a lot today about, various subtopics around suicide prevention. And so I think one of the most important things are being able to talk about resources that exist for people, because, help is possible, help is out there. And so are there any resources that any of you would want to share with those who might be watching or who might watch later?
Yeah, so we've seen that's been really helpful. The crisis text line, I think you can find it at crisistextline.org. But if you're a resident of Tennessee, you can text TN to 741-741. It's private, it's confidential. You can text somebody and they'll connect you with mental health resources throughout the state.
I would also add that Centerstone itself has a crisis line in the staff. We did a Facebook Live video before with one of the staff members from our crisis line, and that staff is all trained in military cultural competency. So they understand, the factors or the unique elements related to military lifestyle. And so that crisis line is 1-866-781-8010.
I really appreciate everyone's time today. And of course, if you're watching now, this video will be available on our Facebook forever afterwards. So you're always welcome to access it later. And I'll just say, again, thank you. And we do have more information on our Centerstone website at centerstone.org/suicide. And you can always give us a call at our main number, which is 1-877-HOPE-123. But with that, I'll let you all get back to your days. And just again, thank you so much for joining us.
Thank you.
Thank you,
Thanks.
Justin. Thank you, Don.
Thank you.
Thanks, Robert.
Appreciate it.